Good afternoon, dear patients. Today we will discuss a case presented in the picture. A patient came to our clinic who had been suffering from Balanoposthitis for a long time. What is Balanoposthitis? It is redness of the glands and the foreskin. Numerous advisors and doctors initially diagnosed him with candidiasis and treated him extensively and actively with Clotrimazole and Nizoral, but without effect. Then they prescribed him tons of medications that are supposed to kill the fungus, ranging from Diflucan and Fluconazole to others, but there was still no effect. Competent urologists advised him to undergo circumcision. He did this too, but this didn't have any effect either. As a result, he came to our clinic in general in a fairly detailed clinical picture, which is presented in the figure. Accordingly, even externally, it was very reminiscent: psoriasis. However, this patient's relatives did not suffer from psoriasis. Even with a careful examination, no psoriasis was found on other areas of the skin. Psoriasis was diagnosed for the first time in our clinic. Accordingly, at first the patient did not believe that it could be psoriasis at all. He thought, as is fashionable now in many circles of patients, everyone thinks they are being scammed in a private clinic and things like that. So, in such a case, they were offered a histological examination. However, I did not advise him to undergo a histological examination because essentially that would mean cutting off a piece of the penis, simply because of the patient's whim that he doesn't trust doctors. I completely understand such patients who, after suffering, have turned to many different institutions, but, well, in general, communication between the patient and the doctor should be based on trust. If that trust isn't there, then of course it's not worth being monitored or treated by that doctor. Accordingly, the patient was prescribed anti-psoriatic treatment, specifically the Hungarian protocol, sodium thiosulfate, calcium gluconate, folic acid, and so on. Injections combined with vitamins along with ointments. Which ointments were used? After all, people generally like ointments and think they're the most important thing. In this case, we tried ointments for about 1.5 to 2 weeks as a trial, but unfortunately, without injections and the rest of the treatment, they did not produce any effect. Which ointments were they used? These were Naphtoderm cream, sulfur salicylic ointment, and other ointments used for treating psoriasis. Accordingly, when we added injections and proper treatment in about 3 to 4 weeks, this psoriasis completely resolved during the course of treatment. What pleasantly surprised the patient was that for the first time in, I think, 4 or 5 years, he saw his penis clean without any rashes. Therefore, accordingly, in general, we managed to completely, so to speak, at least temporarily solve this patient's problem, which, as you can imagine, made him extremely happy. With any rashes in the genital area, even if you are not sure whether it is related to a sexually transmitted infection or not, and so on, it is better to consult competent doctors. Of course, without tests, these problems are often impossible to solve. But in this particular case, actually, a simple examination by a competent doctor was more valuable than all sorts of tests. And not a pile of tests that were done. Without a doubt, if it weren't for that pile of tests, which the patient brought with him, he had already been tested for everything possible, then it would not have been possible to say so confidently. In any case, I would have also checked again for candida, for allergies, and so on. But in this case, the patient really did have all these test results on hand, and of course we did not repeat these tests unnecessarily.